everyone. Welcome to another episode of The Dispatch. I'm Amy Rosenau with KDHE's Office of Communications, and September is Preparedness Month, so we're here to learn a little bit about the Preparedness Program here at KDHE and some of the things that they do to help Kansans and our healthcare providers, local health departments, and volunteer organizations get ready for any type of emergency that might occur in our state. So today we're here with Samantha Ramskill, who works in our Preparedness Program, and we're going to talk today about our Health Alert Network and our registration of volunteers. Yes. So welcome.
Thank you.
Can you tell us first what a Health Alert Network is?
Well, it's a secure internet-based emergency alerting system.
And how do we use Health Alert Networks, or HANs as we call them in Kansas?
Well, they're public health messages that are sent to specific health organizations or to alert appropriate people, and it can be alerted by either their organization, by a group, by their role in HAN, by the employer type, or by county, and it's all done while delivering confidential messages to those people.
So some people may have seen a health alert come out from KDHE about like blue-green algae, or if we're issuing a press release that healthcare providers need to see ahead of time just so they're aware. So those kind of messages do go out over the Health Alert Network, or HAN. So how do healthcare providers or local health department staff get those alerts?
They can either get them by email or by text messaging, and they sign up for it on their profile in the system.
And how would they sign up?
They can go to, well, for the Kansas HAN has to be sent through a unique invite code. So they would need to send an email to our HAN admin, which is kshanadmin@kdheks.gov. And then we can send them the invite code that they would be able to then log in and set up a profile.
Okay. So the HAN is a really great way to get information ahead of time whenever there's a public health need or a public health emergency. So that's a really great resource for providers and local health departments. So if you're not signed up for Health Alert Network yet, definitely do that. We send out a lot of really great information over our Health Alert Network for everyone involved in public health. The other thing that you work on in the Preparedness Program is early registration for volunteers. Can you tell us a little bit more about that?
Yes, we call it K-SERV here. It is actually part of a national mandate for those states that receive hospital preparedness funding. Each state is required to comply with certain guidelines, but there's flexibility on how we can implement it. So Kansas' system is K-SERV, so it's the Kansas system for the early registration of volunteers. We have to be able to register the professionals in the healthcare field. We're able to apply emergency credentialing standards, and we work with KDHE on creating badges for those. And that helps us because it's actually across state lines, so it's not just in Kansas. So if you go to Nebraska, it's the same credential level there that it would be here in Kansas. A credential level 1 would be anyone that works in a hospital setting. A credential level 2 would be anyone that's in a clinic or a private care facility. A level 3 would be anyone that's like in a government that's not currently using their license but still holds a license. Like we have several that work here that are currently nurses, still hold their nursing licenses, but they're not actively using them. And then a level 4 would be anyone that is like a retired nurse or the student, anyone that has the knowledge but doesn't still currently hold the license.
Can you tell us an instant where you've had to implement K-SERV or request volunteers?
Okay. The Redding tornado in May of 2011 is a good example of that. With that, we had volunteers that were requested for the mental and behavioral health side. It was over Memorial Day weekend. We sent out the alert, and there was 14 people that were able to respond. So we were able to get more help to them over that weekend.
So that's really interesting, because when we talk about early registration of volunteers and you talk about healthcare providers, you don't always think about the mental health side of things. So there's a lot, I guess, of different areas where people might be able to help and not know that. So can you talk about the different types of people that might sign up to be a volunteer?
So we look for like doctors and nurses, of course, those are big ones, but we also look for like therapists and dentists, pharmacists, veterinarians. We actually have a a team of veterinarians through the state K-SERV program. Also, like radiology technicians and sonographers. So pretty much just anyone in the health and medical field.
Wow, that's really great and really interesting information. You wouldn't, didn't really think about mental health providers, but also veterinarians. I wouldn't have thought that they would be in this system, but it makes sense if there's an emergency. Pets are part of the family too. So,
they are.
So how do people sign up for K-SERV?
So to sign up for K-SERV, you would just go to our website, ksprepared.org, and there is a logo for K-SERV on the main page there. Just click on it, and there will be a link to be able to sign up to register.
A lot of great activities going on in the Preparedness Program, especially during Preparedness Month, and we hope you learned a little bit and maybe are inspired to lend a helping hand if you're able during emergencies or disasters in Kansas. So again, thank you for joining the Dispatch today, and we'll see you on the next episode.